Okay, so we're looking at the shoulder. So if Luca makes a funny face, you can see the suprasternal notch right there. And so from there, we can find the proximal end of the clavicle. So this is called the SC joint, where the sternum and the clavicle articulate together. And so we can still move laterally along the clavicle, along the body of the clavicle right around here. It's still moving laterally. And so we're going to find a prominent bump right there. So this is where, this is the AC joint. So this is where the acromion and the clavicle articulate together. And this is a common injury site. So when someone has a separated shoulder, they're talking about the separation between the acromion and the clavicle. And then if this happens, you will see one of the AC joints will be slightly raised and higher than the other. Next, we move laterally and posteriorly. We'll find another prominent bump right there. So this is the acromion. And then next, from this general area, we can see, or we can't see, but we know that the anterior fibers of the delts run this way, middle fibers of the delts along here, and the posterior fibers of the delts move along in this general area. So from the acromion still, we're going to move posterior towards the elbow and slightly medially as well. So we're going to find bony part right around here. So this is the greater tubercle, and you can feel it if you have the patient internally rotate and externally rotate their arm. You can feel bony prominence here, and then you can feel it kind of move off, and then out you can feel another bony prominence. So greater tubercle and then lesser tubercle is just slightly medial as well. Next we have the humeral shaft, which articulates with the shoulder. And then if we move posteriorly along the lateral side of the humerus, we have the deltoid tuberosity. It's a common attachment site for the anterior, middle, and posterior fibers of the deltoid. Next we have the coracoid process. So also starting middle shaft of the clavicle and then moving posteriorly, you'll feel a kind of hook bone feeling, I guess. And then this is where the pec minor attaches as well. Then pec major is one of the main muscles for internal rotation of the shoulder. And so this attaches at the bicipital groove of the humerus along with the long head of biceps brachii. So this is when the patient has his arm supinated like this and slightly flexes his arm. The long head pulls the arm and attaches at the bicipital groove as well. And next, is that it?